My name is Dr. Ruby Day. I'm a pediatrician who's been practicing for the past 17 years in the Mid-Atlantic area. Reach Out and Read is a fabulous program in which pediatricians are giving books to families and children. And the whole purpose of doing it is so that we can start promoting early literacy. And when we say early literacy, we're meaning newborns up to the age of 5. Yeah, one of the ways that medical providers make time for Reach Out and Read in a well child visit is they actually incorporate it into the visit. So we've talked about when you walk into a room, you're giving a gift of a book, which instantly creates a bond between that provider and that child and also the parent. But then as a provider, when you have that book there, you can actually do developmental assessment with the child. You will be opening up the books. You can talk about the different colors you're seeing. Some of the books, they have rhyming, and so you do rhyming with the kids and you see if they're picking that up. For the parents, I talk to them about what they should be expecting at various developmental ages and what's appropriate. Reach Out and Read is so much more than a book giveaway program. Reach Out and Read is the books that we hand out are always developmentally appropriate. And so you're teaching the parents what to expect from that child at that age. And that gift we're giving of books has a long-term impact. All the studies have shown that not only does Reach Out and Read create a great bond between the parent and the child, but we also notice that it promotes early language and literacy. We also notice that kids tend to be better prepared for kindergarten. They are actually doing better on testing once they get into formal education. Reach Out and Read really strengthens the bond between the caregiver and child just by the action of reading itself. 1, you're putting the child in your lap. 2, you have your arm around them. And 3, you're actually taking time to do one-on-one interaction with the child, which helps develop trust. It helps create a nice, warm, safe environment. And then you're also learning how to play and interact with your child, which your child is absorbing and growing from. So one of the things that I really love about Reach Out and Read is the fact that I'm able to order books that all my patients can relate to. And that can be based on the color of their skin, the language they speak at home, whether they have 2 mommies, 2 daddies, or they have a mommy and a daddy. There's tons of books to choose, and it's pretty powerful for me to be able to walk into a room, hand a book to the child, and the child sees themselves in the character of the front page of that book. Reach Out and Read, and when we sit here and we talk about it, it sounds like that the parents and the families are the ones that are getting all the benefits from the program. No. Every pediatrician that does Reach Out and Read, they have so much joy in the ability to be able to give a book and sit down and interact with a child. No one goes into pediatrics because they're going to be making tons of money. They go into pediatrics because they want to spend time with their kids. And Reach Out and Read really allows us to sit down and do that. Some of the other things that I think we benefit from with Reach Out and Read is the fact that if a family knows they're getting a book every time they come in, if they are creating a bond every single time that book changes hands between provider and parent or child, they're more likely to come back and do their health assessments. And when they come in for their health assessments, well, wonderful. That's a great time to catch them up on their vaccines and any screening blood work that might need to be done. So Reach Out and Read is currently in 4.4 million households across America, and our goal as an organization is to reach 10 million households by 2030. And that is actually only half of all households with a child under the age of 5. But can you imagine if we were actually able to achieve that? We are not only creating a better bond between child and parent, but we're setting up these children for academic success, which means that they contribute to society in a positive manner in the long run.